Good evening, good evening, good evening, one and all. My name is Sarah B. Yes, you're listening to the evening show, and I'll be with you all the way through until 10 o'clock tonight. Of course, Abdullah Erakat will be back again at 8 o'clock with some more Middle East eyewitness news in store for you. What a great show we've got lined up for you tonight. As per usual, from 9 o'clock to 10 o'clock, we've got the Love Zone, and that's the time when you can send a dedication to that special someone in your life. Also, there's a competition going on for the person who can write the best love letter to Barry Hill. We need to tell Barry how much we love him. So you can feel free to do that to love@ramfm.net. Don't forget our pop quiz coming up at 20 to 9. You can win yourself a wireless mouse if you answer 2 questions correctly. And before that, our top 8 at 8, which is where you get a chance to vote for your favorite song. You've got another 40 minutes or so in which to do some more voting if you'd like to. You can log on to our website, ramfm.net. Click on the icon that says Top 8 at 8 and cast your vote. What we've got here is we've got a bunch of songs that are in the top of the charts, but you, the listener, you vote for what you want at number 1 and number 8. And of course, always at 7 to 7:30 as we start the show, we ask the experts a question. Tonight, our expert is Dr. Les Glassman. He has a dental practice in Jerusalem along with his brother Jackie, so it's a family dental practice, which is always great. And the topic that we're going to be talking about with Dr. Glassman mainly is the prevention of tooth decay and how important it is to prevent this. But of course, the man is a dentist, so any questions you would like to ask him about dentistry generally, he is an expert. He's available to you from now until 7:30. Please feel free to give us a call on 02-679 0000. Now, I would very much like to wish Malin Sophia Katarina Bergen a very, very happy birthday. Who is that, you might ask? She is one of the members of the Ace of Base, the Swedish pop group. So here it is, all that she wants from Ace of Base. Happy birthday, Lynn! Happy birthday, Lynn, from everybody at Ram FM. It's your birthday today. You're listening to the evening show. My name is Sarah B, and it's time for Ask the Expert. My expert tonight is Dr. Les Glassman, who runs a dental practice in Jerusalem along with his brother Jackie. Now, here is a man who knows that he has done a good job when effectively he is out of business. Why do I say that? Because when people no longer need his services is when he knows he's done a good job. So in just a moment, we're going to speak with Dr. Glassman.
The all-new 93.6 Ram FM.
Hey, Dr. Glassman, good evening.
Okay,
how are
hi.
you?
Okay. How are you?
I am fit, fat, and flourishing. Thank you for being on the show with us tonight.
It's a great pleasure, and thank you so much for inviting me to participate in the show.
Well, you're most welcome. It's a really very, very important topic that we're talking about here, really, which is hints and tips to keep our teeth in our mouths for as long as possible.
Absolutely.
Now, I was just saying earlier that one of the ways you know in which you're doing a good job is that when people don't need to spend a lot of money at your practice.
So that is the whole idea. Preventative dentistry begins basically with the eruption of the very first tooth, and it continues for the rest of one's life. So I've got a patient, she's one of my favorite patients. She's 101 years
No
old.
way. With her own teeth?
She's got all her teeth,
No.
her gums, they haven't receded, and the key is that she's always flossed and brushed her teeth.
You see, now, why did I know you were going to say that? Flossing. Let's talk a little bit about the importance of flossing.
Okay, so basically, what happens is that we have to understand why is there a need to floss? Basically, why is there a need to brush as well?
Yeah.
The main cause of dental problems is basically it's the disease which is caused from plaque. Plaque is the main cause of dental caries and gum periodontal disease. So we have to ask, well, what is this plaque? So basically, in the mouth we have we have normal bacteria, and on the surface of the teeth there's saliva covering the surface of the teeth. What happens is that the bacteria adheres to the saliva, and if it's not brushed off, it forms a matrix. And in the matrix, the bacteria from the mouth, it accumulates, and it forms a film around the tooth. And once that bacteria remains onto the tooth, any sticky foods that one eats, carbohydrates, sugars, the carbohydrates are acted upon by the bacteria, which, with the enzymes, they cause acids. And these acids then go and attack the teeth and cause the decay.
So our mouths are not, in effect, in any way self-cleaning. The saliva in our mouths doesn't cleanse anything in our mouth.
The saliva, it's very important to have saliva in the mouth. But the problem is the bacteria. If the bacteria sticks onto the saliva, then it's not good. That's basically the dental enemy, is this plaque, which is the bacteria sticking onto the saliva, which forms the film around the tooth.
Okay, so now how does that bacteria get to stick to the saliva?
Okay, so if we don't brush the teeth and if we don't keep the teeth clean, then the bacteria, it's very easy for the bacteria to collect. And if there are pits and fissures in the teeth, bacteria can also collect. So there are many ways that we can prevent this bacteria from collecting onto the tooth surface. The most important is to brush twice a day and to spend quite a bit of time brushing, not to quickly take the toothbrush and 1, 2, 3. We have to spend a few minutes in the morning before we go to sleep brushing the teeth using a fluoride toothpaste. Fluoride is another aspect which strengthens the tooth surface.
So so choosing a fluoride toothpaste is important, and spending a good couple of minutes brushing your teeth is important.
Absolutely. Now the thing is that sometimes between the teeth, if we're eating sticky foods, which basically, if I can give over that, so many parents can prevent dental decay and save themselves so much money by just adhering to a few basic rules. The one thing is to stay away from sticky foods. Toffees has very little, basically no nutritional value whatsoever. So if one's child gets a toffee, say at a party or at school or any place, what we tell our patients is to trade with the child, to tell the child, maybe bring the toffee home and they'll get something in its place. And
Like what? Like what?
It's giving the child an incentive not to eat that toffee.
But I love that. I love that. Stop there for a second. That's divine. So my kid comes home with something unhealthy, says, Mummy, I didn't eat this. Here, you take it and swap it for something that's more healthy.
So there are many things. We can give nuts, we can give crisps, we can give a plain chocolate. There are many, many nutritional foods that we can give, which are very tasty. Some kids like chewing gum, sugarless gum. It encourages the saliva. It's very healthy for the teeth. There are many, many substitutes that we can give instead of any of the sticky foods. The problem with the sticky foods is that when the food sticks to the tooth and you've got the bacteria, the plaque on the tooth surface, that's what causes the acid and that's what causes the decay.
Okay, so again, Liz, you're not saying stay away from all sugary sweets. You're simply saying that those ones that stick are particularly nasty.
So those are the nasty ones. If one has, there are many things. If one, we're just using, just thinking about if we have a cool drink or fruit juices, things like that. After you've drank the cool drink or the fruit juice, to rinse with water, so you're buffering the acidity in the mouth. And the reason why we basically floss the teeth is sometimes if we have something sticky, even with brushing, it's very hard to take that sticky part which has gone between the tooth surface. And when the sticky food that remains between the embrasures between the two teeth, it can actually cause decay between the teeth.
My guest is Dr. Les Glassman, a passionate dentist. If you have any questions for him, why don't you give us a call on 02-679-0000. Listening to me, Sarah B, on the evening show on the all-new 93.6 Ram FM. It's 22 minutes past 7, and we are asking the expert. And tonight we're speaking with Dr. Les Glassman, passionate dentist. Les, again, thank you so much for joining us. We've got a few people on the line who'd like to ask you a question. Philippa is one of them. Hi, Philippa.
Hi, how are you doing?
Good. What's your question?
I want to know, my son, he's 12 years old, and he's got very, very white, like, stains on his front teeth.
Like white spots.
Yeah, like white spots. I want to know what causes this and how we can get rid of it, because we've been told by dentists that they can't do whitening. And he's very self-conscious about it, and I want to know if anything that, is there anything that we can do to take it away?
Les, is there anything they can do about their son's white spots on the teeth?
Okay, Philippa, thank you so much for the question. Basically, the truth, we don't really know what causes those white spots. They think possibly it might be a calcium deficiency. Sometimes you have little white spots in the nails or the fingers, but that hasn't been 100% proven, and it's not in all cases. Basically, with those white spots, when he's a little bit older, one can put a composite filling over the tooth aesthetically. It would look a bit better. And if it really worries, then if it's very large white spots at a later age, one can always put like a veneer or a covering over the tooth, which is something more permanent.
So that is just a physical looking thing. It's not going to damage the teeth particularly.
Yeah, now those white spots it's not soft tissue. The dentist has examined and they've taken x-rays and they see that it's not a decay. Sometimes you have decalcification where part of the enamel has decalcified, it's lost its minerals. So then one needs to do a restoration of a white filling, a composite on that tooth. But I would clean it well, use fluoride. I wouldn't do bleaching because it would maybe exacerbate it. Those white spots would be more prominent.
What's so great is there's still some stuff about teeth.
But there's a lot we can do in the future. There are many things we can do. I would just hold on till about the age of 18, 19, sometimes till the gum level is fine, and then a veneer is a very, very nice type of restoration.
Are your gums still growing as a kid?
Yeah, the thing is, till the age of about 19, the gums are growing, and you don't want to do a crown or veneer till the gums are stable.
Fascinating. Well, we've got Michelle on the line. Going to go straight to her. Michelle, what's your question?
Hi, Sarah. Michelle, Tel Aviv. Dr. Glassman, I have a couple of questions. My daughter, when she was very young, she had all her enamel was eaten away by the apple juice.
Wow.
And then, we went to a private dentist, and he replaced, he put on the special covering on her teeth. I can't think of the English word right now. But anyway, to this day, first of all, he fixed up the problem, and all her baby teeth have fallen out. But her new teeth, she gets a lot of plaque. And every 6 months, I take her to the hygienist to have her teeth cleaned. But my question is it okay for her to floss the teeth? Because we're talking about flossing
Okay,
before.
how old is your daughter?
10. She's 10.
She's 10.
Yeah.
Okay, so basically, at 10, she should be able to brush herself, and at the age of 10, she should also be able to floss her teeth.
Yeah.
Is there a time when you shouldn't floss? Up to what age? When should you start flossing?
So basically, we call it the manual dexterity of the patient. Till the age of about 7, 8, it's very difficult for kids to floss their own teeth. Sometimes even to brush their teeth. So we encourage the parents till the age of about 7, 8 to brush and to floss their kids' teeth.
Now, Les, are there some people that simply acquire more plaque than others?
So it's true. There are some. Some have, in their saliva, some have less saliva than others. What I would recommend for your daughter is to drink a lot of water as well. Maybe to chew sugarless gum. So we have to look, maybe there's a dry mouth and that's what's causing more of the plaque to accumulate. Also to be very, very particular on what type of foods she eats. Not to stay away from the sticky foods. That's really, really important.
Michelle, does it concern your daughter, the state of her teeth?
Yeah, a little bit. That's why we've carried on with this private dentist who, has a very good reputation, and we used to go see him every 6 months because she had this major problem with the teeth. Now we go kind of once a year. But I think probably concerns me more than it concerns her. And I was just listening to you talking about the flossing and the plaque, and I've got to quickly go.
Okay, Michelle, can I make a suggestion?
Yeah.
I'm sure your dentist does it, but I would basically go twice a year, once a year for x-rays, just to make sure that there's no decay between the teeth, interproximal decay, and to mention to your dentist, and I'm sure he would do it, to put, it's called sealant on her molar teeth, the permanent molar teeth.
Yes, no, she actually has sealant on all her teeth.
That's wonderful. Yes. So you're doing really, really well. That's fantastic. Yeah. And by placing the sealant, it will really prevent decay from forming because the level of the tooth is more flat, and if any, you don't have these deep fissures and sealants where very deep areas where food can collect and cause problems.
Michelle, thank you for your call. Let's just go back to what you're saying. With sealant, you mean, this is news to me, you covering your teeth with something that prevents the plaque from attaching itself?
Yeah, okay, so the sealant is a wonderful invention in dentistry. Basically, when we look at a permanent tooth, when it comes out, it's got pit and fissures and very deep crevices within the teeth.
But isn't that for a reason? Isn't that to help you chew your food?
It might help you chew the food, but it can also have a very disadvantage in that a part of the food that remains in those deep areas can remain there, and then the acids can form, and then it can form decay. And if we look at so many patients, going back more than 20 years ago, most patients had fillings in the very back teeth.
Yes, that's the first place that most of us get them.
So now when we've been doing sealants for over 20 years, where as soon as the tooth comes out and we x-ray to make sure that there's no decay, then we etch the tooth, we make sure that it's clean, and then we put a sealant over using light cure where the material goes and it just covers the tooth and can still bite very nicely. The occlusion is good. You double check that there's no high spots, and the patients never complain of not being able to eat well, and it's the most remarkable, effective way of preventing fillings in the back teeth. And reduce the incidence of decay in the back teeth with unbelievable results.
Wow. So now, once you've actually already had fillings in the back teeth, is there any point in putting the sealant on?
Okay, so then we have to look at the age of the patient. Sometimes when you have a wisdom tooth that's really at the back, that's very difficult to clean.
Yes.
So often we cover the wisdom tooth with the sealant. But once you've already got the filling, and it depends how deep and how extensive that filling is. If the filling is a very small filling and there's still other parts of the tooth that are exposed, we don't want to wait for another filling to happen, so we prevent it by using the sealant. And it really has worked wonders.
So much to talk about, so little time. We've got a question from Oren. Hi, Oren. What's your question for the doctor?
Yes, I want to know how my son has holes in his teeth. He's petrified of going to the dentist. Maybe the dentist can help me. How can I convince him to go? I don't know what to do.
Okay, Oren, there's a few things. First of all, how old is your son?
His birthday tomorrow is 10 years old.
Happy Happy birthday.
Happy birthday. So, there's so many ways one can make the visit to the dentist a very pleasurable experience. We can make it as a treat. The first visit when one goes to a dentist, we should try not to do extensive work on the patient.
He was diagnosed with about 2 holes in his teeth. He has to have treatment, and he's petrified.
Okay, so it depends. When he comes, there's ways of treating as well. If it's a baby tooth, one doesn't always have to give an injection. If they've taken X-rays and they see that the decay isn't that deep, so sometimes one can use different methods of removing that decay without anesthetizing, without giving the injection, which a lot of the young kids are very nervous about. Another very, very good method is to use happy gas.
I've never had happy gas. I'm dying to have happy gas.
That's a wonderful adjunct, a wonderful way of calming the patient, of making it a very pleasurable experience.
And Les, what's also important, and Oren, what's important, like any other medical practitioner, you need to find one that you feel comfortable with, or in this case, that your son feels comfortable with. If the first person you go to it makes your son terrified, perhaps you should look for another dentist.
Oren, can I ask, have they taken X-rays of your son?
He didn't even get to that point.
Okay, because that makes such a big difference. Once you see it and you can diagnose it on the X-ray, which is so important.
I know, but from their school, they get, like, if I pay like a certain amount of money, they get the treatment on the teeth covered. I can take them and they take care of all the treatment.
Okay, can I make a suggestion? Tell your son that he doesn't, a big thing, and if I can convey this to our listeners out there, a very big problem sometimes with the fear of going to the dentist is, unfortunately, and I'm not mentioning you, Aaron, but there have been some parents that have told their children, if you're naughty, we'll take you to the dentist or the doctor, which instills such negative connotations about dentistry. So we want to reverse that whole concept of a negative feelings and fear, and rather to make it into a treat, something pleasurable. And many of our patients come in, they sit on the chair, they have a ride, we explain to them what we're doing. There's very good communication between the dental staff, the oral hygienist, the parents and the child. If it's a small restoration, so there's so many different ways of doing that restoration, which is painless. It all depends how deep it is. And the best way of looking at it is to take a little X-ray, which isn't a painful procedure. When explains, you're taking a little film of the tooth, and we make it exciting for the child. And then once we can see and diagnose how deep the cavity is, then we can treat it accordingly. And in a lot of cases, it doesn't become a painful experience. But if we leave it, and I think this is what you have to really convey to your son, if you leave the decay in the tooth, then it's just unfortunately going to get deeper and deeper, and then it will maybe end up with a root treatment, which is not so pleasant, and it's quite an expense as well. So the whole idea is to prevent the decay from going further and from causing more damage to the tooth.
So you need to go to the dentist as quick as possible once you see there's a problem. So also, instead of saying, if you're naughty, I'm going to take you to the dentist, you've got to say,
that's a no-no.
You've got to say, if you're naughty, I'm going to take you to the sweet shop.
That's wonderful. It's a lovely way of looking at it, but it's true.
My final question to you is, do you study at dental school how to understand patients who are responding to you when you're talking to them with your hands in their mouth? So you go, nice day today, isn't it, Mrs. Smith? And they go, ha, 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 ha. How do you understand that?
It's I'm guilty of that. Many dentists are guilty of that. We love our patients. We just want them to enjoy the experience being at the dentist. I think most dentists are basically guilty of that. Sarah, can I leave you and our listeners with just one little funny, it's like a Yiddish curse?
Yes.
This is a Yiddish curse that may all your teeth fall out except for one, so that you may experience toothache.
Oh, that's terrible.
But it's basically our blessing, and my blessing, that dental fraternity's blessing is that may you keep all your teeth and never ever experience toothache.
Les Glassman, may you keep all your teeth and never experience toothache.
Thank you so much for having me on your show, and I hope it's been a help. And if we can just get across to our listeners, prevention